Hello, my name is Chen, and I'm going to be a senior at Bay High School. I am working as a research student for the Medical Laboratory Internship Program at the Cleveland Clinic Cytology Department. My research project is on designing a cytotechnology curriculum to meet changing laboratory needs. Dr. George M. Papanicolaou's justification of cervical cancer diagnosis through vaginal smears validated the field of modern cytology. Modern cytotechnologists are allied health professionals trained to detect and diagnose the presence or absence of disease in gynecologic and non-gynecologic specimen. Early cytotechnologists received clinical training combined with fundamental microscopic studies and cytologic specimen review. However, as cervical cancer mass screening programs became more common, greater demands for cytotechnologist professions and education resulted. Likewise, new technologies, including HPV testing and market demands, are gradually revolutionizing the current practice of cytotechnology. In 2009, new guidelines for Pap tests proposed to increase the baseline cervical cancer screening age and to prolong rescreening periods for HPV-negative women 30 years or older. Age regulations and integrated HPV testing triage may significantly decrease the annual volume of Pap tests. This factor, along with rising non-gynecological cases, may be contributing to the decrease in annual Pap test volumes. In 2010, whole slide imaging emerged as a new technology to facilitate the management, storage, and transportation of patient information through high-quality digital pathology slides. This tool will personalize medicine and accelerate diagnoses. Therefore, reformed educational programs for upcoming cytotechnologists would enhance current skill sets and take full advantage of changing cytotechnologist roles and professional growth opportunities. Recently, there has been greater speculation over implementing possible cross-training skills in cytotechnology professions. My research project takes into consideration cross-training skills, including histologic staining, FISH or fluorescent in situ hybridization testing, flow cytometry, and dye-gene HPV tests as a means of improving current educational standards. And here are just some additional pictures of possible cross-training skills in surgical pathology and histology. The purpose of my research is to evaluate potential cross-training skills and ancillary competencies in order to determine optimal changes to a corresponding cytotechnology education. A general perspective of the cytopathology community over the changing professional climate can also be gleaned by a research survey. It is hypothesized that Pap test regulations, along with new technology in non-gynecological and HPV testing, will require changes in the current practice of cytotechnology. The existing curricula will need to cope with these changes as a result. Based on survey results, new entry-level competencies and cross-training skill adjustments will enhance the effectiveness of cytotechnology education. The study was conducted using a Google Docs survey. Focus questions as well as survey topics were formulated in order to ensure maximum data results and conclusions. Survey topics included demographics, entry-level competencies, integration for cross-training skills, and possible curriculum additions. Next, an interval scale was implemented in which 1 represented the lowest importance and 5 represented the highest importance. A preliminary survey review was conducted after completing the online survey form and sending an informal email notification to interested regional healthcare representatives. The sample population included cytotechnologists, physicians, cytotechnology educators, and others. Additional email addresses were supplied through professional organization websites. Here are some demographics gathered through the survey. We first asked survey takers what professional title they held. Then we asked them what type of healthcare institution they originated from, whether it was a private community hospital, a private lab setting, or an accredited cytotechnology university. This chart subjectively illustrates the extent of influence that certain external and internal factors have on the future of cytotechnologists. Based on overall mean ranks, we can conclude that there is a significant amount of concern for changes in profession. There is a greater variability among age of population in patients and the automation of gynecologic screening. So these variables have less of a definite impact on the future of cytotechnology compared to that of new Pap test guidelines and declining and declining cytology professionals. The pie graph on the left describes the reasonable length for a gynecologic didactic portion of cytotechnology, and it also includes necessary courses and competency levels. Approximately 46% of survey takers judged that a 6-month gynecologic didactic portion should be implemented in a reformed cytotechnology education. There was an equal preference for 3- and 4-month-long didactic programs at 23%. The chart on the right evaluates the importance of fundamental cytotechnology education and entry-level competencies. Established competencies indicated a gradual shift in preference to liquid-based and automated gynecologic screening methods. Also, a greater importance was placed on non-GYN cases because of high mean ranks among FNA screening and adequacy assessments. Since there was a general favorability of fundamental courses and competencies currently taught, these areas are considered of high importance to an improved education. Approximately 87.8% agreed that FISH testing should be integrated into a cytotechnology curriculum. About 46.9% of survey takers agreed that basic flow cytometry should also be incorporated. A notable discrepancy between digital pathology as cross-training skills and as an educational element was observed. When asked whether digital pathology should be utilized as a broad cross-training skill, it received a mean rank of 3.52. However, when specifically inquired whether it would be beneficial to include cytotechs in a digital pathology manner and to provide more efficient collaboration, data sharing, and diagnoses, overwhelmingly 81.6% of survey takers agreed. A supplemental question showed that approximately 65.3% of survey takers agreed to cross-training in pathology, histology, microbiology, and other upcoming medical specialties. However, there has been a larger variability about the mean ranking values compared to previous graphs. Ancillary skills in histology and surgical pathology were less favorable compared to FISH testing, immunohistochemistry staining, and Diagene HPV tests. A comment box was integrated in the online survey form. Some survey takers hypothesized that institutional size and type would influence preference toward cross-training skills. One of the conclusions was that there was a need to adjust cytotechnology curricula and expand expertise in order to correlate within the changing cytopathology profession. We determined that HPV testing, Diagene testing, FISH staining, and interpretation, as well as special histologic IHC staining, are the most highly desired adjuncts to professional skill sets. It is recommended that basic cross-training skills should be implemented within existing cytotechnology curricula. Because of time constraints, there is a need to increase sample population and distinguish regional populations for more accurate, unbiased results. I'd like to give a special thanks to my mentors, Sandra Dolar and Dawn Underwood. I would never have been able to finish my project if it wasn't for their help in proofreading, and all their time and effort was greatly appreciated. I also want to give special thanks to the Cleveland Clinic Cytology Department for helping me finish my survey, give great feedback, and participating in the preliminary survey review. And lastly, I want to thank the Cleveland Clinic Office of Civic Education Initiatives for providing me with this wonderful internship opportunity.